Hello everyone and welcome to a new session of medical terminology. Our topic today, or in our topic today, we are going to cover the prefixes. For the prefixes, we have two main parts. In this session today, we are going to cover the part one. Then, in next session, we cover the remaining of the prefixes, the most popular common prefixes in the practice, in the clinical practice. Okay, let's dive in. So I am Dr. Khalid Hassan, a professor of clinical pharmacology and clinical research. As you can see in this slide here, we are going to speak about prefixes regarding size and amount, regarding numerical numbers, regarding locations, speed and movement, and the last one will be color for the today covering. Okay, for example, size and movement, we have macro, micro, hyper, hypo, and for the numerical prefixes, we have centi, mono, di, then we have tri, quadruple, tetra. Speaking about prefixes, we have epi, peri, endo, intra, exo, extra, enter, trans, di, per. Then we have midi or medio, para, juxta. Then we have tachy, brady, brachy, A, B, A, D, Ds. Then we have for the color, we have different maybe terminology. We are going to use it like lico, erythro, cyano, and chloro, and so on. Okay, so we'll start with maybe every group of the prefix. For example, here's to start with the size and amount, move to the numbers, location, and so on. Okay, let us start with the size and amount prefixes. The first one here with always bring the prefixes with some examples to clarify the meaning, to remember the meaning, to maybe keep this, understand the prefix for a long-term memory and remember this meaning. Macro here refer to the something large or long. When you talk about macro refers to something large or long. The example here, microscopic. Macro mean large, and scopic mean related to the viewing. Meaning of the macroscopic is like structures visible to the naked eye, such as bones, organs, and so on. Another one here, we have macro related to the long or large. We have macrocytes. So in the blood cells, we have macrocyte, we have microcyte. So macrocyte mean large, macro large, and cyte means cells. Here meaning abnormal large red blood cells, microcyte, and we have this could be or refer to some type of anemia, microcytic anemia, for example. Microcytic anemia, this is the case we have it due to the deficiency of folic acid, for example. Okay, looking on the Google images here, and something we can see with the microscope, something we can see it with the naked eye. For example, here, if you go to the iris here, and then we have visible to the naked eye, no need for microscope, and they provide us the meaning for the microscope. Okay, moving to the next medical terminology. Okay, then we have micro. Micro refer to the small or microscopic, and the example here, microscope. Micro means small, and scope instrument for viewing. Meaning of microscope is like device or instrument used to view small objects that are not visible to the naked eye. So this is a microscope. Then we move to another maybe example for micro. We have microorganism. So microorganism here, the micro we know that is small organism. Organism mean living entity. Microorganism mean tiny organism like bacteria or viruses. Okay, this is through the Google images. When you type microscope, and you click on the image, and they show you the microscope, different type of microscope available as the images there. Then if you click on the microorganism, you can see the creature, could be bacterial, could be viruses, that can be seen under the microscope, under this device that able to magnify the images. Okay, next slide regarding size and amount prefixes. We talk about hyper, mean, excessive, and above normal. Excessive and above normal. Hyper, mean, excessive, or increase. We have hypertension, for example, here. Hyper mean excessive or high. Tension mean pressure, and here we're talking about high blood pressure. Another meaning for another terminology for hyper, we have hyperglycemia. Hyperglycemia, hyper excessive or high glycemia, blood sugar, and the meaning will be elevated blood sugar. When the patient suffer from hyperglycemia, chronic hyperglycemia, this case refer to the diabetes insipidus. Hyper, we use it for several medical cases. For example, we have hyperthyroidism, we have hyperparathyroidism, we have um, hyperkalemia, hypercalcemia. We have several type of maybe medical word linked to the hyper in the clinical practice. Okay, here's some example from Google images. I give the credit to the Google image for this picture here. It's not my picture. It's coming from Google images. It's not related to any website. When you click on type hypertension and search the Google image, search and click on the Google images, they take you to the several images and the Google images about the topic you're looking for, hypertension. So we speak about some people suffer from elevated blood pressure. Okay, moving to the next terminology, medical terminology, we have hypo, refer to the below normal or deficient. Example, we have hypotension. Hypotension mean low blood pressure. Hypo mean low or below normal. Tension mean pressure. The meaning for hypotension mean low blood pressure. Moving to the another maybe example here, hypoglycemia, hypo low or below normal, glycemia blood glucose or blood sugar, and the meaning of hypoglycemia decreased blood sugar. Okay, speaking about hypotension, if you type it in Google image and search the Google images, and they give you the hypotension, and we have the criteria for hypotension. Someone may ask what is the value when we call the patient suffer from hypertension. So if you type there here the definition of hypertension and scroll down to know about what is the real value for to consider the person suffer from hypotension, and they said it's like it should be lower than 90 over 60. 90 here we speak about systolic blood pressure, and 60 we talk about diastolic blood pressure. Okay, moving to the next medical terminology, we have hypo. Hypo mean below normal or deficient. Hypo here. Okay, so we covered the hypotension and hypoglycemia. Okay, next medical terminology, we have euthyroid. EU refer to the normal or good, normal value, normal level, or good situation. Euthyroid, you here mean normal or good. Thyroid gland, thyroid stands for thyroid gland. Here we talk about normal thyroid function. Okay, normo, talking about normocyte. Normo mean normal, cytic, normocytic, related to the blood cells, related to the cells. When you talk about cytic, related to the cells. When you talk about normocytic, here we refer to the normal size of red blood cells. So normocytic mean normal size of red blood cells. If you put the euthyroid in the search bar, on Google image, and they give you the definition of euthyroid mean normal thyroid function. Euthyroid. Again, when you search the Google about normocytic or normocytic, here we have the normal size of red blood cells. Okay, moving to the next medical terminology, we have ban, refer to the all or entire, and here the example, ban cytopenia. Ban mean all, cyto mean cells, penia here we refer to the deficiency, and the meaning for ban cytopenia refer to the deficiency of all blood cells type, red blood cells, white blood cells, and platelet. Then another maybe medical terminology, we have omnivorous. Omnivorous mean omni mean all, various mean eating. Here omnivorous related to the an organism that eat all types of food, including plants and animals. By searching the Google image for pancytopenia, you can see here we are talking about deficiency, decreased number of red blood cells, and we have now anemia with decreased number of white blood cells, leukocyte, then decreased number of platelet. We talk this one thrombocytopenia. So you can see here we have when we talk about pancytopenia, we talk about decreased number of cells in the blood, include red blood cells, white blood cells, and platelet. Okay, regarding regarding omnivorous here, talk about the creatures or like living system. Animals are able to eat plants and animal sources. Again in the slide, we have pancytopenia, mean deficiency of all blood cells type. We have omnivorous, mean an organism that eat all type of food, including plants and animal. Okay, next we have medical terminology. A or an stand for refer to the without or lack. We have anemia. AN stand for without or lack. Emia, the condition of the blood. The meaning for anemia is like a condition where there is a lack of red blood cells or hemoglobin. Okay, so the anemia relate to the decreased number of red blood cells or hemoglobin. Moving another example for A or an as prefixes, we have aseptic, mean a without. Septic mean infection. When you talk about aseptic, here we talk about free from the contamination by microorganism. Okay, in this image here from aseptic on Google Images, here you can see here it's very important to keep the environment, our hands aseptic before, during, and after the operation, surgery operation. And this slide here tried to compare between sterile and aseptic. What is the difference? Again, next slide show us the anemia. You can see here decreased number of red blood cells. If you look on the red blood cells here in this image, the same situation here. You can see the red blood cell decreased number of red blood cells here. Someone may ask about what is the difference between aseptic. Aseptic mean free from harmful organism that cause infection, while sterile mean free of all microorganisms. Again, from the slide here, we have two medical terminology, anemia and aseptic. Moving to the next medical terminology, we have megalo, and we have, for example, here we have megaloblast, we have megaloblastic anemia, for example. Megalo refers to something large or enlarged. Example, megaloblast here. We have anemia, type of anemia called megaloblastic anemia. Blast here mean large, megalo large, blast immature cells. Megaloblast mean an abnormal, large, immature red blood cells found in certain type of anemia. So we have megaloblastic anemia. Okay, megalomania here we talk about a condition characterized by delusion or of grandeur or an inflated sense of self. So we have some images to maybe give example here to clarify the meaning. So we have megaloblast and megalomania. Okay, for the megaloblasts here, you can see the large, big white blood cells, megaloblasts here. Here we talk about anemia. Here we talk about red blood cells, not white blood cells here. Megaloblastic anemia. So you can see here the normal red blood cells, and this is a megaloblastic anemia, large blood cells. again for megalomania. And megalomania here, if you the a condition characterized by delusion, inflated sense of self. So you can see the cat and the lion on the mirror here. When you imagine yourself, you are bigger than a normal situation. You can see the situation here. This is a megalomania. After the location, we move to the after the locations prefixes. We move to the numerical prefixes. Numerical prefixes refer to the quantity or numbers. We are going to speak about mono, centi, di, tri, quad, quadri, tetra, poly, and oligo. Again, mono, centi, di, tri, quad, quadri, tetra, poly, oligo. Okay, start with the first medical terminology. We speak about mono. Mono here refers to one or single. Example, we have monocyte. So mono mean one, cyte means cell, and the meaning will be a single type of white blood cells, monocyte. So it's type of white blood cells, monocyte. We have di, refer to the two or double. We have the diabetes insipidus. Di refer to the maybe two, and diabetes refer to the effect of this disease on the urine production and dilute or excessive. Diabetes insipidus is like condition caused by excessive urination due to the hormone issues. With the hormone here, we talk about insulin deficiency or absolute lack of insulin. Okay, again here as a reminder, we have monocyte type of white blood cells, single type of white blood cells. Then we have diabetes insipidus, meaning the case of hyperglycemia due to the deficiency or decrease or lack of insulin secretion. Okay, next slide. Okay, the terminology here try to speak about tri and quad. Tri refer to the three or triple. Example here we have triglyceride. Triglyceride, tri means three, glyceride, glycerol, and fatty acid. Meaning for triglyceride, here we talk about a type of fat with three fatty acid chains. Okay, so this is for triglyceride. Then we have another quad or quadruple. So you can see the quad refer to the four or quadruple. We have quadriplegia. Quad for refer to the four, plegia paralysis. Here the patient suffer from paralysis of all four limbs. And we have some example from Google image. Okay, let me show you the triglyceride definition here. It's like fat found in the blood. What else? If you click on the images, and you can see the three fatty acid change, and this is the main reason we call it triglyceride. And triglyceride, one of the lipid profile found in the blood. We have triglyceride, then we have LDL, HDL, and cholesterol. Speaking about the quadriplegia mean paralysis of all four limbs here. So this one quadriplegia, you can see it. For example, if you scroll down a little bit, this is this one here. We talk about quadriplegia. So this is a paralysis of four limbs for the patient. Quadriplegia. Okay, in this slide again, triglyceride type of fatty acid, and we have quadriplegia, paralysis of four limbs. Okay, moving to the next slide, we have quadriplegia. We covered that already. Moving to the tetra mean four. Tetralogy, study of. We have tetralogy of Fallot. Mean it's like this is case associated with the congenital heart disease involving four heart defects. The tetralogy of Fallot. So if you click on the Google image tetralogy of Fallot, you can see here we have some deformity, some defect. We have the defect between the two ventricle, we have the defect between the aorta and the pulmonary arteries. So we have several defects in the infant and newly born babies. Moving to the another one. Okay, in this slide we are talking about the quadriplegia and tetralogy of Vallot. Next slide. So we have poly and oligo. Poly refer to the many or large amount. Polycythemia. Poly mean money, and cyth mean cells. Polycythemia mean excessive number of red blood cells. Then we have oligo, refer to the few or little. So you can see the opposite. Poly mean many or large, and oligo mean few or little, small amount. Oliguria, oligo mean few, urea, urine. So the producing very little of urine here, meaning oliguria. Okay, polysemia poly mean to the money or large amount. Polysemia, poly here mean money, and seen refer to the cells, red blood cells. Polysemia mean excessive number of red blood cells. Polysemia. Then we move to the oligo, refer to the few or very little, a small amount. Example, oliguria. Oligo mean few, or urea mean urine, and the meaning will be producing very little urine. Looking on the polysemia, looking on the Google images here, you can see here the patients suffer from polysemia, suffer from increased number of red blood cells under the microscope. Okay, next we are going to speak about prefixes as a location. We are going to speak about epi, peri, circum, endo, intra, exo, extra, enter. Then we have trans, di, peri, midi or medio, para, and juxta. Again, this is indicate the location: epi, peri, circum, endo, intra, exo, extra, enter, trans, di, or pair, midi, para, juxta. Okay, speaking about the prefixes regarding location, the first one, epi, peri, or circum, means around or surrounding. Here we talk about pericardium, peri around, cardium mean heart, that mean pericardium, we talk about the membrane surrounding the heart. Another endo, intra, mean inside or inner. When you talk about endo, intra, we talk about inside or inner or within. So we have endoscopy, and endo mean inside, scopi viewing or examining, and the meaning will be procedure to look inside our body, endoscopy. In this Google image, we have pericardium here, and you can see here the pericardium like membrane surrounding the heart. This is the membrane with the blue color around the heart. Again, this is a pericardium, membrane surrounding the heart. I believe we gave example for endoscopy in previous videos. Okay, moving to the next prefix regarding location, we have exo or extra. Then we have enter. Exo or extra mean outside, outer or exterior. Here, for example, we have exoskeleton. Exo mean outside. Skeleton, we talk about skeleton, the same. The meaning of exoskeleton, the skeleton located outside of the organism. The example here, insects, when we talk about the insects in general, their skeleton located outside their body. We have enter. We can speak about the intercostal, for example, here. Inter mean between, intercostal between the ribs. Enter between, and costal mean ribs. And costal here coming like suffix. A skeleton coming like suffix. Okay, the meaning of intercostal meaning between the ribs. Okay, in this slide here, they present in Google Images, and again, this is a credit for the Google image. Um, as you can see here, we have the intercostal, and here we talk about the space between two ribs. So we have the ribs, and then we have the space between ribs. We call this one intercostal. Okay, speaking about the exoskeleton, you can see here we talk about the skeleton outside the body of the creature. Okay, speaking about the exoskeleton. Okay, next regarding prefixes location, we are talking about trans meaning cross or through. Example for the trans, we have transdermal. Trans mean cross, across, and then dermal means skin. Here we talking about across or through the skin. Transdermal patches. For example, we use transdermal patches for medication for motion sickness. We have transdermal patches called scopolamine for patients suffer from or to prevent patients from suffering motion sickness or dizziness. Another maybe terminology regarding location, die or bear. For example, dialysis here, example, die or bear here mean through or complete. Dialysis here, the dialysis mean breakdown for lysis, or die mean through. When you talk about dialysis here, meaning a process to filter waste product from the blood. Dialysis. Okay, from the Google image here, you can see the transdermal patches. We use it for example, I gave the example for the motion sickness, scopolamine. We use it for the patients of from angina. We can use some nitroglycerin or isosorbate dinitrate. Moving to the dialysis, here you can see the patient on dialysis here, and this is the machine for dialysis. Okay, dialysis process to filter waste product from the blood here, especially for the patients suffer from chronic renal disease and the end stage renal disease. Okay, moving to the next terminology, we have media and we have para. Media mean middle here, as you can see, media, middle. Example here, mediastinum, mediastinum. Media mean middle, and stanium space or region. When you talk about mediastinum, here we talk about the central space and the chest cavity between the lung. So the central space and the chest cavity between the lungs. This is mediastinum, and we are going to present some picture from Google Images. We have para, mean near or besides. We have parathyroid. Parathyroid, again, para mean beside, thyroid gland. When you talk about parathyroid glands is small gland located next to the thyroid gland. Okay, this Google image here show us the mediastinum. Where is the space between the lung here, mediastinums. Okay, if you click on the image, they can show you the mediastinum here again. Okay, this is the mediastinum here, between the space or location between the lungs, mediastinum. Speaking about parathyroid, and as you can see, this is the thyroid gland here in the neck, and we have four small glands, and the thyroid gland. You can see it, parathyroid gland here. Again, we have it here, parathyroid glands, and this is responsible for secretion of okay, parathyroid gland is a gland responsible for secretion of hormone called PTH, parathyroid hormone, and this hormone responsible for calcium balance or calcium homeostasis. Okay, moving to another medical terminology regarding the regarding the prefixes. We have juxta. Juxta mean next or adjacent. Example here we have juxtaglomerular. Again, juxta mean next or near, adjacent. Glomerular mean it's like apparatus, structure in the kidneys. And when we talk about juxtaglomerular, here we talk about the refers to the cells next to the glomerulus in the kidneys. Okay, this Google image here show us the juxtaglomerular apparatus near to the kidney. This is in the nephron. Again, this is in the nephron here, and you can see it's referred to the kidneys and part of the kidney. The kidney maybe consists of millions of nephrons. As you can see here, we talk about the kidneys, and this is responsible for the urine filtration. Okay, in the next section, we are going to speak about movement prefixes as movement here. We are going to speak about AP, AD, DIC, DIS, what that mean for the abbreviation. When you talk about AP in the beginning of the medical word, for example, we have abduction here. We have abduction and ab mean moving away or away from. We have abduction, AB mean away, duction mean movement. Here we talk about movement of limb away from the middle line of the body. Okay, moving to the next word for the movement, we have AD. And when you talk about AD in the beginning of the word, adduction, for example, here, meaning moving toward or closure. So adduction, moving away, moving towards, or abduction, moving away, and adduction, moving towards or closure. So when you talk about adduction, mean towards, adduction, movement. And when you talk about adduction, mean movement of a limb towards or the middle line of the body. Okay, this is adduction, moving towards, abduction, moving away. Then we have DIC, dis, and to separate or take apart, we have dislocation, disseparate, location, place, disseparate, moving from the place, displacement of bone from the normal position in a joint. Okay, displacement of a bone from its normal position in a joint, dislocation. Okay. Okay, you can see here from the Google images, we have abduction. Abduction meaning moving the arms away from the bodies. Then we have adduction, moving the arms closer to the bodies. So abduction away, adduction near to the body. Okay, then we moving to the another one here, adduction, abduction. Speaking about this location, separate. We talk here about displacement of bone from its normal position in the joints. You can see here this is the normal joints. Okay, if you click on this image here, I will close this one. Okay, this dislocation, you can see the dislocation and the displacement of the bone from normal position in the joint. Dislocation on the X-ray to confirm the diagnosis. Dislocation again. Okay, we have dislocation. So we have several examples for dislocation. Again, for prefixes, we have abduction, adduction, dislocation. So we need to remember adduction, moving the limbs away from the midline of the body. Abduction, moving the limb towards the midline of the body. And then we have dislocation, mean displacement of bone. Okay, regarding speed, here we are talking about tachy, brady, and brachy. Okay, when you speak about tachy, mean rapid or fast. Brady means slow. Brachy mean short or slow in duration. I will start with the first one. Tachy, example for that, when you talk about rapid or fast, tachycardia mean increase heart rate. Tachycardia, increase heart rate. So the heart will be accelerate. Tachy mean rapid, cardia mean heart. Tachycardia mean abnormal increase in heart rate. Brady means slow, so the opposite, tachy, brady. Tachy mean increase, and brady mean decrease or slow. Example, bradycardia. Brady mean slow, cardia related to the heart. Here the meaning will be abnormal, an abnormally slow heart rate. And the last one here in the regarding in the slide, brachy, and here we are talking about. Okay, so for the brachy, mean short or slow in duration. Example, brachycephaly here. Brachy mean short, or cephaly mean the head here. That the meaning of this word brachycephaly, a condition where the head is shorter than typically, and often due to the abnormal skull development. Brachycephaly. So we have tachycardia, bradycardia, brachycephaly. Okay. And this Google image here, I'm going to put this link here in the description, because I will give the credit to the Google.com, Google Images, for this providing all these clarification about this medical terminology. As you can see here, if I scroll a little bit back and forth, this is a normal head for the babies, newborn babies, and this is a patient or baby suffer from brachycephaly. So the smaller head, like with the brachycephaly, we talk about the head shorter than typical normal newborn babies. Okay, regarding to speak about the prefix, regarding the colors, we have chromo, chromato, and then we have leuco. Chromato refer to the color or pigmentation. For example, we have chromatography. Chromo mean color, graphy mean writing or recording. Chromatography is technique for separating substances based on their color or composition. So chromatography means separation substances based on their color or composition. Chromatography. Moving to the leuco, refer to the white or colorless. Then we have here leukocyte. Leuco mean white. Cyte refer to the cell, meaning white blood cells, part of the immune system. So we have leukocyte. Okay, speaking about chromatography here, which means separate the substances based on the color, and you can see here that we say in this devices here we try to separate the color. Again, chromatography try to separate the color. We have devices chromatography separating the color. Okay. And then we have leukocyte. Leukocyte here we talk about white blood cells, and you can see here we have several type of white blood cells. We have monocyte, lymphocyte, basophil, eosinophil, and several type, as you can see of this is referred to the leukocyte. We have several type of leukocyte. You can see here type of leukocyte. Continue with the prefixes. Color, we have erythro, refer to the red, and then we have example for that. Erythrocyte, erythro mean red, and cyte means cells. Erythrocyte mean red blood cells responsible for carrying oxygen and other nutrient to our body, to the human body. Then we have cyano. Cyano refer to the blue, and the example here we have cyanosis. The cyano mean blue here. Osis mean condition, and the meaning of cyanosis is like bluish discoloration of skin or mucosa membrane due to the lack of oxygen. Sometimes when you have toxicity with a cyanide, you can see these cases, cyanosis, or when you have some heart congenital disease such as tetralogy of Fallot, you can see the cyanosis. We have some example for that. Okay, erythrocyte refer to the red blood cells. Erythrocyte, okay, refer to the red blood cells. Erythrocyte. Okay, cyanosis. You can see here the cyanosis, a bluish discoloration of the skin. Cyanosis. Okay, you can see the cyanosis. This is a case when the baby suffer from teratology of Fallot. Cyanosis. If you click on all, for example, they give you the condition here, a condition that causes skin, lips, or and nail beds to appear as bluish purple. Okay, last slide regarding the medical terminology prefixes, colors. Here we have chloro, refer to the green. Chlorophyll, we have chlorophyll here. Chloro refer to the green. Fill, leaves of pigment or pigment. Chlorophyll here, a green pigment found in the plant, responsible for photosynthesis. Then we have melanoma. Melan refer to the black or dark. Example here, melanoma. Melan mean black, or oma as a suffix mean tumor. And this melanoma type of skin cancer characterized by dark or black pigmentation. Refer to the yellow. Flavoprotein. Flav mean yellow here. Protein. We don't have definition for protein. Consists of amino acid. Flavoprotein, a protein that contain a yellow pigment, often involved in the metabolic process. Flavoprotein. Okay, here we have some images for when you click on the chlorophyll and the Google images here, and they show you some the chlorophyll regarding to the green pigment found in the plant responsible for photosynthesis. You can see here the chlorophyll in the plant, chlorophyll. So all these responsible for photosynthesis in the plant. Then we have melanoma, a type of skin cancer, and we have several type of melanoma that require a close medical attention and to see your healthcare provider when you have any pigmentation on the skin, melanoma. And the last one here we have flavoprotein, and flavoprotein here we talk about like a yellow pigmentation in the metabolic processes, and you can see here the yellow protein available in the skin, in the cell membrane. Yellow protein, we have several yellow protein here in the process, so several yellow protein, flavoprotein. Okay, this will conclude our session about the medical terminology, prefixes, and we covered the prefixes part 1, and next session we are going to cover part 2 with the prefixes regarding the medical terminology. Thank you so much for your watching, and have a great day, everyone.